The broadcast is now starting. All attendees are in listen-only mode.
Good morning. This is Dawn Miller from the Healthcare Authority. We will start in a couple of minutes. We're going to give others a chance to log on before we get started. Thank you. Good morning, everyone. I think we're going to go ahead and get started. I would ask, can everybody see my screen? Should be able to see a welcome and introduction slide. You can go ahead and type into the chat box if you're able to do so. So once again, my name is Dawn Miller. I'm with the Division of Behavioral Health and Recovery and the Healthcare Authority. I'm a Supported Employment Program Manager, which means that I provide training related to foundational community supports IPS. So anything individual placement and support related within foundational community supports programs. We also have with us this morning Taylor Danielson, who's the research manager for the Research and Data Analysis Division, and Leeza Lorence, who's the foundational community supports manager for AmeriGroup. The session is being recorded, and the recording will be sent out at a later date along with PowerPoints. And then if we discuss resource items as we're talking that the group might want, you can make requests of those, and I will make sure to send those out as well. So the intent today is that Taylor will provide his presentation, Leeza will provide hers, I will provide mine. You can ask questions in between or certainly type into the chat box if you have questions as we go along. So after each section, we'll allow for questions. And then at the end of the three presentations, we'll allow for questions. You can see that you can either ask questions verbally by unmuting or through the chat box. So having said that, I'm going to hopefully turn the screen over.
Oh, we lost you, Dawn. Oh, sorry. You are not. I didn't want to stop showing. Hold on a second. Sorry about that, folks. So let me pull up slides here. I apologize. I was actually thinking that Dawn was going to have the slides up on her, and then she was just going to pass control over to me. So that was a little bit of a fumble on my part. So let's pull these up, if it will let me. Okay, so I'm going to talk to you a little bit about clients who are currently enrolled in the Foundational Community Supports programs based on, and give you a flavor of the types of folks who are enrolled and what their background is. And I'm going to be doing this using some of the information that we have available at RDA from what we call our integrated clients database. And so just to give you a little bit of background on research and data analysis, we are located within the Department of Social and Health Services, and we work with various stakeholders across multiple government agencies or administrations to help do evaluation research. That's sort of our bread and butter. We also do some other program support activities and things like that. Part of what we do at RDA is bring together information from multiple source systems and link that information together so that we can see what a client's experience was across multiple systems. And what I mean by this is that starting in the early 1990s and then continuing on to today, we have some very smart folks who have figured out that there are identifiers that link clients across systems. So the P1 ID is available in ACES, or the ACES IDs are available in P1, and P1 IDs are available in Alta's data system, et cetera. And as well as information like first name, last name, date of birth, social security number. And they figured out how to link together information from these different systems so that we can see what a client's experiences were, not just in terms of their healthcare, what kind of healthcare they received, but also were they arrested, were they homeless, did they have a mental health treatment need. And so what we've done for the FCS program thus far is leverage the data that we have available to us to paint a picture of what the clients look like in the program. And so the first thing I want to talk about is how many clients do we have enrolled? And Leeza's got some more up-to-date numbers, but I'll give you the numbers that we had as of our last Foundational Community Supports Program administrative report, which is available online at the Healthcare Authority's website. So when we looked, we had about 3,073 clients enrolled in the program, or I'm sorry, 3,321 clients enrolled in the program. Of those clients, 58% were supported employment only clients, 36% were supportive housing only clients, and then we had 6% who were both supported employment and supportive housing. And you can see one of the things the RDA did in support of FCS is we did some forecasts where we looked to see how many individuals, we basically provided some information about how many individuals we expected to see in the program over time. And right now we've actually exceeded what our original forecast was in terms of clients enrolled. And part of that has to do with the fact that the caseload composition is slightly different than what we expected. We expected there to be more supportive housing clients and less supported employment, and we actually have the reverse. But one of the things to keep in mind, while we're exceeding our forecasted caseload, we did expect that the individuals would have a higher engagement rate than what I think are seeing in the data currently. So, there's some offset here where, as we know, a lot of individuals may express interest in supported employment and get enrolled in the program, but they may not necessarily receive the services later on. So, again, just kind of breaking down who's currently in the program, we have the majority of the clients are supported employment, but we do have 6% who are in both supported employment and supportive housing. So about 2/3 of the clients in total are supported employment clients of some variety. And when we looked at monthly enrollment, what we see is that there are 72% of the clients who are enrolled for 1 to 6 months. And while I know a lot of you on the attending the webinar are supported employment providers. For those of you who aren't, the way that the program is structured is that individuals are authorized for services for a certain time period. So if you meet the eligibility requirements for the program, you can speak to AmeriGroup. AmeriGroup, who acts as the third-party administrator for the program, will enroll you in the program. They'll help you identify a provider. And then for that first, you're authorized for a 6-month period of services. And within that, if you're receiving, that covers up to 30 supportive housing services, which are which is a day unit. So 30 days of services. And then for supported employment, it covers 120 service units, which are measured in 15-minute increments. And what these clients can do is, if they use up all their services in the first before the 6-month period is up, they can ask for an exception to the rule and be authorized for additional services, and that typically involves some negotiation with their provider. And Leeza can speak to this a little bit more if there's anything that I might be misstating. So we have 72% of the individuals in the program who've been enrolled for 1 to 6 months, and then we actually have 27% who've been enrolled for 7 to 12 months. So they've been enrolled continuously for 12 months and have had a second authorization. So this really illustrates that we are providing ongoing supports for at least a third or close to a third of the clients in the program. And then we have 1% of clients who've actually been enrolled for more than a year at this point, and are in their third authorization period. And when we shift our attention to supportive housing, it's a little bit different, but fairly similar. We have 79% of the individuals are enrolled again in that first authorization period, and then 21% of them have been enrolled for 7 to 12 months. In terms of the demographics of the clients enrolled in the program, and this is all based on the administrative report that's available at the Healthcare Authority's website, what we see is that 54% of the clients who are enrolled in supported employment are male, while 46% are female. This is as of February 27th. And 69% are white, non-Hispanic, while 31% are any minority. And we don't provide the breakdown by different minority groups because the counts start to get a little bit small, and we want to make sure that we protect their information. But this gives you a sense that we have a fairly large number of individuals who are white, non-Hispanic in the program at this point. In terms of the age distribution, 79% of the individuals are 25 to 64, and then the next largest group of individuals enrolled in the program are 18 to 24, and that's 15% of the clients. We're not really having a lot of penetration with young clients with mental health or substance use disorder treatment needs, or who are engaged in some of the other programs or receiving ALTA services or things like that. So that's an area of potential improvement, is to do some additional outreach to 16 to 17-year-olds for this particular benefit. And then we have only 4% of the clients enrolled in the program are 65 or older. When we shift our attention to supportive housing, the gender distribution changes a little bit. We see that 52% of the clients are male and 48% are female, and 71% are non-white, non-Hispanic, and 29% are any minority. Now you'll notice that the age distribution changes a little bit, and it's because we're missing that 16 to 17-year-old category, and that's because of the eligibility requirements for supportive housing. What we see is that that the eligibility requirements have been set up so that for supported employment, individuals can be 16 or older, but for supportive housing, they have to be 18 or older. And again, 6% of the clients are in that 18 to 24 range, so we have additional work we could do with individuals who are younger and doing outreach to individuals who are younger. 88% are 25 to 64 years of age, and then 6% are above the age of 65. And for those of you who are wondering, the reason why we have fairly large age ranges provided here, specifically that 25 to 64 range, it again is because of small cell counts and small counts, and we're following HCA's suppression guidelines. So what we've done, rather than suppress those counts, is just lump them together into a broader age category. In this slide, what I'm going to be talking about a little bit is the different types of Medicaid eligibility coverage that clients, or Medicaid eligibility categories that clients fall into and the types of coverage they're receiving. So when we look at supported employment, what we see is that the majority of clients are actually expansion adults under the Affordable Care Act. 33% are categorically needy, blind, disabled, and that includes Medicaid only and full dual eligibles. 11% are categorically needy, family, medical, and pregnant women. 4% are categorically needy and CHIP children, and then the last 4% are categorically needy, aged, and again, that includes Medicaid only and full dual eligibles. And we have a lot of duals enrolled in supported employment, so 1 out of 5 clients are dual eligible, which means that they are receiving Medicare and Medicaid, and that actually has affected our ability to provide some additional information. So for those of you who would actually have seen the administrative report or are going to go read the administrative report later, you'll see that there is some information on the mental health treatment needs of these individuals, how many of them have a mental health treatment need, how many of them have a substance use disorder treatment need, how many have a co-occurring disorder, and various breakouts along those sorts of lines. And we're working toward updating the reports, and because of the dual enrollees in the program, we don't have access to Medicare data currently, but we're working to incorporate it into future reports. And what that does, or what that means, is that because we don't see Medicare claims, we actually might be underreporting the prevalence of mental health and substance use disorder treatment need among clients enrolled in the program, because the information we have is only for Medicaid only clients. And so just keep that in mind, that the prevalence rates might actually be higher when you look at the administrative report that we have out there currently than what we're seeing right now. But just to speak to that a little bit, we do have very high, just based on Medicaid only claims, we have very high mental health treatment need prevalence rates, and also a large co-occurring disorder population enrolled in both programs. Shifting to supportive housing, again, we see just to note, we see that categorically needy children and the CHIP kids fall off of this graph, and that's because, or this chart, and that's because supportive housing is limited to 18 and older. But largely the same sorts of trends. We see that 44% of the clients are expansion adults, 40% are blind or disabled, categorically needy. We have 9% are categorically needy, family, medical, and pregnant women, and then that last 7% are the categorically needy, aged. And similar distribution of individuals between dual status, so 1 in 5 are dual enrollees, again, getting Medicaid and Medicare coverage. Just looking at cross-system enrollment, one of the things that we see in this program is that 24% of the clients in supported employment have actually received a referral from ESA, the Economic Services Administration, for the housing and essential needs benefit. So they're eligible for the referral, and then they can take the referral over to Commerce, and then Commerce will do some additional eligibility determination and provide them with the housing and essential needs benefit, which is for individuals who typically have some sort of disabling condition and are needy. And then we see that 10% of the clients enrolled in the program meet the HUD criteria for chronic homelessness. And for those of you who are not familiar with what the chronic homelessness measure captures, it is an individual who has been either homeless for 12 months continuously in a given year, or in the past year, so you look back and every month in a year they show up as homeless, or they've been homeless 4 or more times over the past 3 years, with the total number of months that they are homeless being equal to 12 months. So there's this chronicity aspect to it, and then there's also just length of time. And then another part of the HUD criteria that is by default met for clients enrolled in SES program is disabling condition, so typically mental health treatment need or substance use disorder or physical disability or something like that. And so that has been met for these clients, so it's really just that time component. And then supportive housing clients, as you would expect, the rate of chronic homelessness is higher. So about 1 in 4 clients are chronically homeless based on the definition I just provided, and then 32% of them have been referred for housing and essential needs services to Commerce. And just want to speak really quickly to the number of individuals who are receiving services from ALTSA. We do have a fairly substantial number of clients receiving services from ALTSA, so it's, I think, in the realm of 20 to 25% for both programs. And then of those, there's about 15% roughly who are both have an active care assessment with ALTSA and then also have some sort of mental health or substance use disorder as well. So there's overlap between the systems, and we're seeing that we have clients from both the mental health and substance use disorder treatment realm, as well as the long-term and aging populations, so long-term care and aging populations. So with that, I'm going to turn it over to Leeza. And, oh, wrong thing. And let her present on her side of things.
Thank you very much, Taylor. Did anybody have any questions for Taylor at this point in time? As I mentioned, you can also ask at the end of things, but if you do, you please use the chat box as an option. All right, so we're on to Leeza.
Hi, everybody. Thanks for having me join you. So let me see here. I'm going to try to actually move my screens around real quick. Okay, looks like I'm not going to be able to do what I was trying to do, but that's okay. So I'm Leeza Lorence, and I'm one of the FCS managers at AmeriGroup. And as you all probably know, AmeriGroup is the third-party administrator for the Foundational Community Support Program. And so I'm just going to share a little bit of information with you all about the enrollee count and configured a different way than kind of what Taylor was talking about, our provider network, and some other things, and then answer some questions that we received before the webinar. So as you can see, we currently have over 3,300 people enrolled in the FCS program to date. So that means that those are people who are currently receiving, have current authorizations, meaning they're in that 6-month authorization period and are receiving services from either their employment or their housing provider. And in the table that you see here, SE stands for supported employment, SH for supportive housing, and then there's a column for those who are enrolled in both employment and housing services. And this is broken out by region throughout Washington. And then for our provider network, we have been really busy building our provider network this last year. And as of 2 days ago, we have 99 contracted providers. So what you see in the table here, the 292, those are the number of sites, and it's both broken out by region, again, for supported employment, supportive housing, and then those providers who provide both employment and housing services. So basically, although we have 99 contracted providers, some of those providers have multiple sites. So those multiple sites are reflected here in those numbers. So one thing that I wanted to address while we're on this slide is we received a question about how many referrals have been received per month to show the growth of the program since we started. And as you all probably know, this program started January 2nd. of 2018. So we've been going for a little over a year. And in January of 2018, we had received about 45 assessments. And then that increased to about 75. And then in March, it jumped up to nearly 200. And it continued to increase pretty drastically from there. And where we're at now is we're receiving well over 1,000 assessments a month. So we are receiving a lot of assessments, which basically means we're receiving a lot of referrals from our contracted providers and from ULSA. And there was a question about how many have been served to date statewide. And so, as I mentioned on the previous slide, we do have over 3,300 individuals who are currently enrolled in the FCS program, but that does not reflect the individuals who have expired authorizations. So, as Taylor was talking about, every individual who is enrolled in the FCS program has a 6-month authorization period. And so when that end date approaches, sometimes we see a reauthorization sent in by the providers saying that this individual needs those support services to either maintain their employment or housing, their job or their housing. And sometimes we don't receive a reauthorization. So it could be that the client has, stopped communicating with the provider, or that they no longer need the services. So those individuals aren't reflected. So we've actually served more than 3,300 with this program to date. And one other thing I wanted to address is there was a question about, have there been requests for extensions of time authorized for services? If so, how many and for what reason? So the answer is yes, there have been those requests. So we call that an exception to rule request. And we've received a little over 100 ETR exception to rule requests. So really, it's not that many if you think about how many individuals we have enrolled in the program, and that we've only received requests for roughly 100. So, I think one of the things at the beginning of this program, we heard a lot of providers expressing that they were concerned that there weren't going to be enough benefits in that 6-month authorization period. However, it seems that those benefits and that length of time within the 6-month period has been going further than was initially expected. So that's really great to hear. Okay, so going back to the slide deck here, I'm just going to speak a little bit to what we've been doing and kind of what the direction is that we're moving towards. So as you know, the program launched January 2018, and we had a really quick turnaround to get the program up and going, to contract and credential with providers, to build that provider network so that referrals that were received had a provider to work with and start receiving employment or housing services from the providers. So that's really what was focused on in 2018, was building the program, setting up all the processes, figuring it out. There was a lot of flying the plane as we were building it, so to speak. And in 2019, we've really started focusing on quality improvement standards. I know that both DBHR and AmeriGroup, DBHR looking at Fidelity reviews, and AmeriGroup has been doing our quality assurance reviews as well. So there's a lot of quality, all of eyes looking at our program, and we're making sure that we're really providing quality services to FCS enrollees. And then moving forward, we're really going to be evaluating the effectiveness of the FCS program with the goal of continuing this as a permanent Medicaid benefit and coming up with that sustainability plan. And, you know, with this being a 5-year Medicaid transformation project, we have a little less than 3 years left. So this is a really important piece that we're looking at as well. And then I just wanted to share some resources. I'm sure many of you are familiar with this, but our AmeriGroup FCS provider website has a lot of resources on it. So you can check out the FCS provider manual there, the referral forms, the assessment forms, the quick reference guide, which goes over eligibility criteria for the program, is also available on the website. And then there's the provider resource guide, which is on the HCA's website, and that has contact information for our state agency partners, DBHR and ALSA. And then there's also the AmeriGroup's client website, which gives a real nice, simple overview about what services someone can receive from the FCS program, who's eligible, and it talks about it in a way that is fairly easy to understand. So those are some resources that are available. And then here is our contact information at AmeriGroup. Our 844 number is listed there, and we answer the phone Mondays through Fridays, 8 to 5. And then here are the 3 FCS managers. So you can always reach us if you have any other questions.
Thank you very much.
That wraps me up.
Thank you, Leeza, very much. Does anyone have questions for Leeza at this point in time?
Yeah.
All right, so we'll go ahead and continue going. And as I mentioned, you can, you can, I'm trying to multitask, and Taylor and Leeza and I were just having a brief conversation prior to this about the fact that multitasking really doesn't actually happen. We may think that it does. We may try to do so. It typically doesn't happen. So there's proof positive. So once again, I'm Dawn Miller. I wanted to start out by respecting the fact that we got some questions prior to the webinar. And one of those was, do you track the date of referral versus the date of vocational profile to determine average time completion? So obviously you can see that in the other question. What I'm going to say is one of the expectations within Fidelity for individual placement and support is that each agency tracks per individual the date of referral, the date they complete the vocational profile, the date of first job or second or third or fourth or fifth job, however many it takes for that job to truly end up being the good match that we always hope that it will be. So those are pieces of data that the agencies actually collect, and that as a Fidelity reviewer, I look for when I come in and end up doing a Fidelity review. I know that at the end of this whole project, there will be a great deal of data synthesized, in part with the intent of showing legislators that this is worth throwing money at again. I'm biased. I was joking with somebody the other day about the fact that I drank the Kool-Aid. So part of what I end up seeing related to the importance of continuing this are the individual stories, the individual success stories. So part of those stories relate back to How long did it take to help a person to find a job that's a good fit for them? How long did it take for an individual to start receiving that service? So thank you to anyone who sent in questions prior to the webinar. Truly appreciate that, and you're going to get a chance to ask more at the end of things today. So one of the things I wanted to go over were some of the resources available to foundational community supports providers. And they vary a little bit related to eligibility. So this is not all the information related to the different resources, but some of the information. If you have more interest, you can contact me after the webinar to find out more. One of the things that we have available to providers are seed grants. And you can see there it says for providing needed support for the initial employment of direct service staff until their roles are sufficiently deployed to permit billing Medicaid for supported employment service on a fee-for-service basis. I will say that we are now also, oh, I see where it says audio has been lost. So hopefully you guys can still hear me. All right.
We can hear you, Dawn.
Okay, good deal.
We can hear you.
Yeah, I'm looking and saying the audio has been lost, so hopefully hopefully others can still hear too. There we go, restored. Sorry about that. So seed grants are related to supportive employment. We also have seed grants that are now going to be starting for supportive housing. The intent of that is to be able to hire staff so that programs can do startup. We recognize the fact that it's difficult to be able to get a program up and running and to hire staff and get moving forward when you're not receiving income as yet. So this is an intent to actually solve that issue. It's administered by the Washington Council for Behavioral Health and specifically Mike Hatchett. So you may have seen emails related to the seed grants from him. Application includes a letter and then completion of the application face sheet. And it's this year it's intended to be one per agency with evidence that the new staff has a caseload of at least 5 people within 90 days. This is truly intended to help programs get up and going, and with the intent that you're going to have paid staff that's going to provide the service over time. So just one of the things that we've done over a period of time to attempt to help agencies to be functional and be able to provide the services. Another resource or grant in this case that is available to agencies is the Fidelity Review Incentive. Leeza mentioned that within this year, we're really focusing on quality. And part of that focus on quality is starting to do Fidelity reviews in order to see how close agencies are providing services to the Fidelity scale. I'll talk a little bit more about that in a couple of minutes. But we recognize once again that it takes time, effort, and to some degree that equates to money to be able to either host a review and send a reviewer or to send 2 reviewers to a Fidelity review. And so there are grants available. There are still grants available for agencies to apply to either host a review and send 1 reviewer or to send 2 reviewers. In this case, you will likely have seen an email from Lisa Bennett Perry. In it, it will talk about the fact that as an agency, if you're doing both services, you choose which one you want to have reviewed for Fidelity. And it is very definitely a choice. And this year is all voluntary. The intent in the future, the hope in the future is that we'll be able to do Fidelity reviews for every agency that's providing foundational community supports. So in part, what this is doing as far as training reviewers is building our bandwidth so that it will be possible to do more reviews in the future. Having been in an agency that had a Fidelity review done, I can tell you it's a lot of work from the standpoint of arranging for everyone to be available to have an interview done with them by the Fidelity reviewers. But it's also an amazing process in that you get a report card of sorts. And if you're like I am, and I know an awful lot of you probably are, and you want to always provide the very best service that you can, this really helps to do that. it provides an opportunity to get that feedback so that you can determine areas in which you might want to improve. So if you're interested, once again, in the Fidelity Review incentive, send me an email or send it directly to Leeza. Either one will work, and I have contact information at the end of my slide, so I will share those with you too. All right. So much as Leeza mentioned that there are FCS resources on the AmeriGroup website, there are a variety of online resources. Our intent is always to help to teach so that providers and the direct service staff and provider agencies have the tools that they need to have in order to be able to provide a good service. So one of the things that some people may have heard about, they may have tuned into the last month's webinar with Melody Paisolt, where she talked about Pathways to Employment and the Supported Employment Wiki. Pathways to Employment is Washington State's website that's actually gained some notoriety. It's one that's being replicated in other states because of the quality of what it provides. It has just a variety of tools on it, one of them being a benefits estimator. I know I've mentioned that to at least some of you. There are things like, for individuals, there's an option to be able to click on a link that would allow them to search businesses near their house. For those folks that have problems with transportation, it can be a really beneficial item because it'll allow them to start thinking about, if I don't have great transportation, what's close by. There are a bunch of provider tools in addition to the tools for individuals receiving services. So there are copies of forms, there are copies of webinars, there are copies of, actually one of the things that they have available there is we value very, very much the inclusion of peers within the service programs that are the programs that provide services. And so there are modules that are training modules on the Pathways to Employment website for peers. There are 3 modules that I believe are already posted on there, and I know that WISE, Washington Initiative for Supported Employment, is working on a 4th. So do please take advantage of those kinds of things. There are tabs within the Pathways to Employment site that relate to individuals that have justice involvement and some of the ideas as far as what they might need to do in order to find employment and be successful. There are tabs for other kind of special needs or special areas of interest. So do please check it out when you have time. Very recently, we also developed a Pathways to Housing website. There are similar kinds of things on the website there. There's actually a budgeting tool, if you will, on the Pathways to Housing website, so do please check that out. There's a supportive housing wiki and a supported employment wiki. For those of you who are like me, when I first heard wiki, I thought, what the heck is that? It's essentially an online library. It has an amazing, or they both have an amazing amount of information on them. Each of these webinars that we record, we're putting recordings online as well as the PowerPoints that go along with them and any other resource materials. If there are trainings that are coming up, we try and put information about those on there. Individuals are able to make, you have to be a member of the wiki, so it's something that you have to send to me or one of my colleagues in order to ask to have the wiki made available to you. But you can post comments on there, you can ask questions, you can post job openings, just a huge number of things available there. For those of you providing supported employment services, and you've heard me talk a lot about individual placement and support, or you've heard Leeza talk also a lot about individual placement and support. The IPS International Learning Community website is ipsworks.org. They have a library, I think, of 162 items, some of which are the forms that we talk about that are beneficial to use in order to be able to track things or assessments for individuals in order, like the career profile is on there. You'll notice that because it's international, some of the documents are in Norwegian, some are in French, some are in Spanish, and obviously the majority of them in English. There are reports and white papers, if you will, related to a variety of things as well, including statistics Taylor did a great job of providing us information, as did Leeza, in regards to numbers of people receiving services. On the ipsworks.org website, if you were needing to perhaps talk to your leadership about the impact of IPS or that kind of thing, there are the statistics from the studies that show that over and over and over again, people end up benefiting from IPS, that justice involvement goes down, that utilization of crisis services go down, that obviously employment goes up, obviously housing goes up. As people have jobs, they're less likely to be homeless. And so there's a variety of amazing information on the ipsworks.org website. And then one of the things I included here, and I hope the link works, I was able to make it work. If for some reason it doesn't for anyone who wants to access it out that's listening to the webinar, let me know and I will get you a hard copy. It's the guide for documenting Medicaid services, or with a Medicaid lens. There's been a lot of questions about that. And I think there's a lot of providers that perhaps haven't had a whole lot of experience of documenting, say, a progress note so that it demonstrates medical necessity, so that it indicates why it is that you're doing the service for the person. Why can't they do for themselves? What is it about the challenges that they experience that causes them to need to have your assistance? So that's kind of one of the bottom line kinds of things that shows up in that guide for documenting. So as I mentioned, if for some reason you have any problem accessing it, do please let me know and I will make sure that I send a hard copy to you. That could be one of the things that I actually send out with the recording at a later date. All right, so because our hope is that we always provide enough in the way of training and information to agencies so that they are able to provide the services, improve on services, have the resources available at their fingertips to be able to learn and grow and do and then share that information with individuals they serve. We also have a variety of live training events coming up. The Division of Behavioral Health and Recovery last year ended up contracting with 5 nationally known agencies to provide us with technical assistance so that we can provide you with technical assistance. One of the trainings that's coming up, or a series of trainings, is through the Washington Initiative for Supported Employment. They're going to be doing training in, I'm probably not going to get this right, I want to say it was Everett, Tacoma, and Spokane, but don't hold me to that. You'll see the invitations as we go on. One of the individual placement and support principles is that benefits planning needs to happen for individuals on caseloads. And I know agencies have asked over and over again, how do we do that? How do we access training? Where do we gain the knowledge that we need? The benefits planning training through WISE will be a live training event. You'll have the opportunity to sign up. There will also be a webinar, and it will be recorded, and it will be readily available. This isn't intended to make you a certified benefits planner, but it is intended to give you the basic information that you need in order to be able to talk to people as they come into the program. And then it also provides information so that when you're in deep water and the person absolutely has to get in to see a benefits planner. I know that benefits planners are not as prevalent as we might have hoped. Some agencies have them, but very few. But keep in mind always that Division of Vocational Rehabilitation does have benefit planners. And then community-minded enterprises and plan to work is something that's been contracted with the state of Washington to provide benefits planning. If somebody needs the information to contact them, I can get that to you at the end of things too. Fidelity reviewer training. Some of you may have gone to one of the trainings. I know I've gotten a lot of questions about, here's another notification. Is it the same thing? We are intending, my colleagues and I, to provide the Fidelity Reviewer trainings on supported employment and supportive housing on each side of the state about quarterly. So when you see notifications, the likelihood is if you've seen another one that looks very much like it, it's the same training. It's just being done at a later date. We have one coming up in May over on the west side of the state. I think we discussed probably July doing another one on the east side of the state. We just did one in Spokane last week, in fact. So if you have an interest in going to the Fidelity Reviewer training, those will be up and coming. One of the issues with that Fidelity Reviewer training is obvious that, by the title, you're being trained to be able to be a Fidelity Reviewer. But a piece of that whole process, and I think what I got in feedback from the group that I provided training to, was that they learned just a lot about individual placement and support. Even if you're not going to be a Fidelity Reviewer, it's worth your time to go and listen to what information is being presented, just from the standpoint of learning so much more about IPS. Then if you do decide to be a Fidelity Reviewer or host a review, you get so much more information there. I know that the two individuals that had volunteered to be reviewers were from an agency up in Colville, and both of them commented on the fact that they learned a great deal and that there were things that they were going to take back to their agency to improve upon services. One of the trainings that's in the works, and I mentioned we contract with various different national consultants. Virginia Selleck from TAC, and I'm going to have to apologize. Technical Assistance Corporation, I think, is what it stands for. They're one of the national consultants. I apologize that I haven't got, what the acronym means right off the top of my head. But Virginia is well known and an amazing presenter, and she and I are working on a presentation related to rural job development. If any of you have ideas about the challenges or successes or things along that line that you experience as a rural job developer, let me know and we'll include information in the training. And I will be sending out a survey. Lisa will also send out a survey to various different agencies to seek some feedback as we're crafting this particular training. It is going to happen at the end of September. And at this point in time, we're talking about it being, on the centrally located in the state so that anybody can access it. So do please stay tuned. And then Joe Maroney, the end of May in Spokane, is going to be providing a training on collaborating with behavioral health and other agencies. One of the things that, if you're familiar with individual placement and support, that you may have noticed is that, or you will have noticed, I shouldn't even say may, it slaps you between the eyes, is that IPS was written for mental health agencies. We aren't using IPS for just mental health agencies anymore. And we're not the only ones in that scenario. IPS is now being used, and in fact, there's starting to be studies done for things like spinal cord injury, for traumatic brain injury, with individuals that have intellectual disabilities, as well as with people with mental health issues. And a number of the providers throughout the state that are providing foundational community supports are not the traditional mental health or behavioral health agencies. So there's a challenge with doing things like embedding yourself within the mental health treatment teams because you're not part of that agency. And so this training is going to be intended, and once again, this is one we're crafting right now. So if you have questions or suggestions, please send them to me. But the training is intended to provide feedback as far as how you might do that when you're not part of a mental health agency, or just in general, how you might collaborate with other agencies. It's very apparent within IPS that one of the important principles is that we build support teams around the person. So individuals or agencies that might have an impact on the person's employment, or their employment might have an impact on what's going on with those agencies, should be involved in a support team. They should know what's going on. An example being if somebody has a condition for which they need medication, it may be necessary to check in with the medication prescriber periodically. They're not necessarily going to be part of meetings and things along that line, but they certainly may be someone with whom you collaborate. Definitely, and I heard Taylor mention that a great majority of the people receiving services have mental health or substance use disorders. And in that case, it's vitally important to be in contact with their service providers if they're receiving services, and to let them know what's going on related to the employment, as well as to get information as far as what's going on just in general related to persons services, so that you can be on the same page. I know with substance use in the agency that I had worked for, a lot of folks were mandated to be in treatment, court mandated to be in treatment, and very often there were groups that they had to attend. A lot of those groups were daytime groups, which actually impeded their ability to find employment. So there were options to attend groups in the evening, but the provider needed to know that in order to be able to schedule the person to attend the groups that they had to do in the evening. So very important to collaborate with the different agencies involved in a person's treatment and support. Obviously, family members are a piece of that as well, and that's not necessarily going to come up in the training that's being provided. Just an important concept that I'm sure you're all aware of. So technical assistance. A big part of what I provide is technical assistance. I end up getting calls or emails or other communication with agencies on a pretty regular basis where they have questions to ask, and maybe they're a one-shot question that's fairly easy to answer, or sometimes there are questions that really lend themselves to the idea of providing training face-to-face for an agency. Lisa, Bennett Perry, me, Amanda Major Polly, Kimberly Castle are the team that goes out and provides technical assistance. So for Lisa and I, it's supported employment. For Amanda and Kimberly, it's related to supportive housing. We go to conferences and do outreach. We provide training at conferences to hopefully reach a wider audience to share information about IPS and foundational community supports and supportive housing. So if you have a training request, if you have questions, please contact one of us. The information will be at the end of the slide so that you have that available to you in order to have the contact information. We do provide regional trainings. I have to say they've happened more often on the west side of the state than the east side of the state. Truth of the matter is we just have fewer providers on the east side of the state, so the regional training hasn't been as effective as has been the individualized training for agencies. But you can see we provide training on job development, Fidelity reviewers training, evidence-based practice principles, so either IPS or permanent supportive housing. Golden thread, we have some webinars and things coming up, and some that have been recorded that may be of interest to people. And then, other as we come up with them. Because we value the idea of training and the learning collaborative, this is part of this particular webinar as part of our learning collaborative. We also have job developers community of practice calls where the hope is that we'll share success stories, so we'll all talk. We'll share success stories, we'll discuss challenges, we'll bring up questions. They are facilitated by Joni Dolce from Rutgers University, and I think she's doing a marvelous job. Second Thursdays, so watch for those invitations. Today is one of the topical webinars that's mentioned there, third Thursdays. There's a supportive housing topical webinar, fourth Thursdays. Brand new is a supervisor learning collaborative, which is the second Mondays. Our hope is to have that be rather like the job developers community of practice, in that we are hoping that supervisors tune in and then ask questions and share success stories and that kind of thing. So it's intended to be interactive. There is also a training component for that one. It alternates between Rutgers staff for supportive housing, and then in alternate weeks, it's Paul Ferris from Public Consulting Group, they're one of our national consultants, that talks about supported employment and supervision. And then we periodically have a limited series or one-time webinars, like what I mentioned we're going to have with benefit planning. So I do hope that you all keep watch for those trainings. If you want to be added to our distribution list, please let me know and I'll make sure that that happens. We provide training on a regular basis with the intent of just helping all of us to be as competent as we can possibly be. Okay, so Fidelity reviews. Leeza mentioned it, and I've talked as well a little bit about that. I'm saying this is the year of the review. We have the plan of providing 20 Fidelity reviews. So 10 for supported employment, 5 on each side of the state, and 10 for supportive housing, 5 on each side of the state. Those would be included within applying for that incentive review incentive grant. There are the 20 reviews. Why do we do Fidelity reviews? The bottom line is that the Fidelity has been researched with data that proves that each functions to improve the outcomes. And when we do a review, we're providing feedback about how close are you coming to actual fidelity. I had somebody say one time within IPS, there's a rating scale where it's not fidelity or not supported employment, fair, good, and exemplary. And somebody said, well, it's impossible to get exemplary. I went to the went to the IPS international meeting a year ago, and there were 3 agencies that were given awards for exemplary fidelity. That's out of the hundreds or perhaps thousands, I'm not entirely sure, I'll have to find out, of agencies that provide IPS services. And so that tells you it's an awfully hard thing to do, but it is possible. What we have seen is that as an agency, the agency that I worked for, our first fidelity review, we ended up scoring at a fair. Our next 2 fidelity reviews, we scored at a good. And so if it's truly to be continuous quality improvement, you can see from the baseline to subsequent reviews that there should be improvement. When there is a fidelity review done, there's a report done that provides you with written feedback. There's also typically a verbal, like a phone call, to discuss what the report means and to answer any questions at that point in time. And then the agency writes a plan in regards to how they're going to respond. Unlike an audit where you're expected to address every single thing, a fidelity review is one in which you make some choices about we're going to devote our time here or there in order to improve things and to choose the things that where you figure you're going to have the biggest bang for your buck. So you can see we're currently accepting volunteers via grant application. And I mentioned earlier, we're building bandwidth while providing learning opportunities. Our hope is that some of the reviewers that are being trained now will continue to assist us over a period of time as they're able in order to conduct reviews. So we hope that we'll get to a point where all foundational community supports agencies will receive a review of the evidence-based service that they're providing. It's a nerve-wracking experience. It's also a wonderful experience. So just something to be aware of. I've actually been there and I can provide information from kind of both sides of the fence. All right. So I'm looking at my clock. It's about 9:31. We're going to open the floor for questions just for any of the 3 of us at this point in time. Do please use the chat box or raise your hand, and I'm kind of looking to see if I see any hands raised. I will also forward, and I'm going to leave slide-wise, leave you with contact information for Lisa Bennett Perry and I. So are there any questions at this point in time? All right, I said I was going to leave you with that slide. It decided that it was going to do it differently. It's real apparent when you listen to me talk as opposed to watching what I'm doing with the screen. I'm a little more technically, a little less technically adept than I am, able to provide the information. This is interesting. I see my mouse or my cursor on the screen. That I have 2 screens in my office, and I don't see it down on the one that I'm trying to actually access. So I am gonna end the slideshow. I will come back to this if you need me to. So, any questions at all? Is there somebody with a question?
Don, I just wanted to...
Go ahead.
Oh, this is Taylor. I just wanted to make a small correction. When we were talking about the supportive housing program and the gender distribution there, it's actually 52% female and 48% male. So it's the opposite essentially of the supported employment services.
Okay.
So sorry about that. So noticed a small error on the slide and wanted to speak to that really quickly.
I appreciate that. I do see here. I see Jeff Spring. Jeff, if you're still available, you can attempting to unmute you. That may not work. So if you wouldn't mind using the chat box in order to ask the question that you had. I see Jeff had a question. Reginald Blackman has a question, and Pam Patterson has a question. So Jeff, are you actually? It looks like you might be unmuted.
Hi, Jeff.
Hi. Yes. Go ahead.
Can you hear me?
Yes, can hear you.
Great, thank you. This is Jeff Spring at the Department of Commerce. So I have a question for Taylor.
Yep.
Looking back at the eligibility slide for FCS, you quoted that 48% of the people that are enrolled via Affordable Care Act expansion, and then the other categories were actually physical or mental conditions. And so it was a little confusing to me because the people that came into FCS via the ACA, that spoke to the vehicle by which they got connected to FCS. The other categories talk to a physical or organic condition. So it was like a little bit like apples and oranges to me. Can you say more about that?
Sure. So it's one of the ways that when we're talking about Medicaid eligibility, there are different types of Medicaid eligibility that are related to different income categories, and then also the type of coverage that a client receives. And so really, I mean, I think that the major dividing line in the sand here is between individuals who are eligible for the FCS program because they fall into those expansion categories. They're expansion adults, so I guess kind of the way I think about it is, but for the ACA, they would not be eligible for these services, or they may have been in some other category, but they were moved into this category. And then the other categories are really speaking to if an individual is categorically needy. And so what that means is there's a certain income threshold as well as some sort of disabling condition or some sort of condition that is attached to that makes them eligible for a particular type of coverage. And really this is not my area of expertise. So I'll say what I understand with the caveat that I may be wrong. But my understanding is that those categorically needy categories tend to reflect some of the older eligibility categories associated with Medicaid. And so the ones that existed before the Affordable Care Act was put into place. So these are individuals who would be receiving Medicaid because they are below an income limit and they are deemed blind or disabled by someone who's doing the authorization. And I think that those folks get authorized through, or their eligibility is determined by the Economic Services Administration, and then they would be eligible for Medicaid under that because they meet that need component. So that's the distinction that's being drawn there. So while you're right, there is some additional thing that's driving their eligibility. It also really comes back to poverty as well as being an eligibility criteria. And then for the ACA expansion adults, they're at that 130%, I believe, of the federal poverty level. And so it's just a little bit broader, potentially less needy population.
Sure. Thanks. That makes a lot of sense. I'm wondering if it's possible to kind of strip off the ACA expansion mask to look at the underlying conditions in that population so that we have like a common denominator for all the enrollees to see what the breakout of physical conditions is, even for those ACA expansion clients. Do you know if that's possible?
Yeah, so that's something we actually were doing in the previous versions of the report. And like I was saying earlier, one of the things, the barriers that we've run into recently is that the data is, we have Medicaid data. That's what we have on hand, and that's what's available through Provider One at the Healthcare Authority. And we get those sorts of claims through the P1 system. And that's how we do a lot of the work that we do. We look at eligibility and we look at claims. But one of the things to keep in mind with Medicaid is that Medicaid is the payer of last resort. And so if an individual has additional coverage beyond Medicaid, and that coverage completely covers the claim, then we will never see that claim in the P1 system.
Right, got it.
And so we do have information on all of the clients enrolled in the program based on Medicaid claims data, but the kind of the issue that we have is that we may actually be underrepresenting their need because we have those dual enrollees, and while we have some Medicare and Medicaid crossover claims, we don't know how many of the services they received or how many of their diagnoses were actually captured by the Medicare data we just can't see. So we're trying to work on incorporating that in. But yeah, one of in some of the other parts of the administrative report, what we do is we look at what do the mental health treatment need of all the clients in the system or in the program look like, not just, and don't break them out by Medicaid eligibility category. But that is something, speaking directly to your question, that is something that we could do, is look at within ACA expansion adults, how many of them had a mental health behavioral treatment need.
Yeah, I think it would be really useful information to have from a, well, actually, I'm not sure why. It just, at a gut level, it seems like it might be useful to know. So thanks for that explanation, Taylor. While I've got you, I've got one other question too regarding the reauthorization period for supportive housing clients. I'm wondering if it was anticipated that many supportive housing clients might need ongoing support services indefinitely. Are those persons also subject to the regular reauthorization process?
So I'll give you my best explanation, and then I'll let Leeza jump in and correct me because she's the expert. But my understanding is that so long as an individual meets the original eligibility criteria and is able to be reauthorized for the service can be indefinite. The only restriction is on the number of service encounters that they can receive within an authorization period. And so that speaks to, on the supportive housing side, that would be 30 services in that authorization period, which is about 30 days worth of services. And then they have to go back and do that exception to the rule like Leeza was talking about earlier, where they talk to their provider and they figure out if they need additional services. But my understanding is that in the initial planning and development of these benefits, there was a recognition that these are going to be ongoing supports, and that we did not want to cut people off from the benefit and time limit it. So, and that's true of both supported employment and supportive housing. We have one of the codes that you see when you look in the system at supported employment clients is we have two codes. We have one which is supported employment pre-employment services, and then there's a supported employment ongoing support services. And the ongoing support services is really, okay, you've gotten into a job and we're going to continue helping you navigate the workplace and your anxiety, and how can we adjust what's going on with your employment to meet your needs and your mental health treatment needs, and work with your mental health provider to say, what kind of, do we need to adjust their medication? Do we need to get them in additional services? Those sorts of supports. And I think Don's put that a little bit. So so I don't think it's time limited. And I'll turn it over to Leeza and see what she says.
Thanks, Taylor.
You're welcome.
Yeah, that's totally right. So that's one of the great things about the FCS program is it's not time limited, and absolutely expected that some folks might need that support maintaining their housing or their job indefinitely. So the idea is, if not for these services, would they be at risk of losing their housing or their job?
Right, and it seems like it's possible to predict that some percentage will absolutely need those services on a permanent, ongoing basis.
That's right.
Right.
Absolutely.
Mm-hmm.
This is Dawn. Within the evidence-based practice of both supported employment and permanent supportive housing, there is a component related to the expectation that will provide long-term support, and that a lot of individuals will need that kind of thing. I say a lot. That's obviously not a number, but
right.
You
So
know,
I guess
varying degrees. Mm-hmm. Go ahead.
What my question was really driving to was, for those people that we know are going to need ongoing supports, is it necessary to make them go through any kind of a reauthorization process when you know their organic condition isn't likely to change?
Yeah, because they still need to qualify for Medicaid. So that's
Okay.
one thing, is that we're checking their Medicaid eligibility every 6 months at that reauthorization point. So there's some other things.
Lots of moving parts.
Thanks so much for your time. I feel like I've hogged enough of the time. Thank you.
Thank you, Jeff, for your questions. Reginald, I see you have your hand up. I'm going to try and unmute you so that looks like you're unmuted. If you still have a question, you should be able to ask that verbally. Reginald, are you there? Okay. And I suppose it's possible you're muted from your end too. Or perhaps there's not a question anymore. I will double check the chat box and see. I don't see a question there. So I'm going to move on to the next person, which is Pam Patterson. Do you still have a question? And I'm trying to unmute you here. Oh, it says self-muted. So you would need to unmute yourself from your end, Pam, to be able to ask the question. All right. While we're waiting for Pam or Reginald to decide whether they still might have a question they would like to ask, I'll encourage anybody else that wants to ask a question to either raise your hand, and you can probably see the little hand icon there, or if you look at the bottom of the list, at least on my list, it's the bottom, there's the chat box, and you can actually type in a message there should you want to. The other issue is, and obviously each of us has provided some contact information with the intent that if you have questions between now and whenever, you can contact any one of the three of us or our colleagues in order to ask questions as you have them too. I'm looking to see if there's any more raised hands. Okay. Reginald, I'm checking in one more time to see if you had a question still. Or Pam. All right. Okay. Actually, looks as though Holly may have had a question. Holly, do you still have a question? I see that I have unmuted you, but it looks like you're also self-muted. All right. And then it looks like, who else? Lynn Christofferson had at least a question at some point in time. Okay, Pam had said she couldn't unmute, so I apologize for that. Pam, if you want to type your question into the chat box. Okay, and I'm seeing some other questions here, so I will read those. Okay. We lost you, Don, and I'm glad that it only lasted a little while. Is it anticipated that most supportive housing clients will require ongoing support services? That was Jeff, so we got that answered. I'm confused by the eligibility slide. 48% RACA expansion, but that title, it doesn't speak to their condition. That was Jeff too. I apologize for reading as I'm scrolling because I only have a small section of the screen that I'm seeing this. So, are we able to serve clients in FCS who are SUD program only, not in mental health? Was one, and that was Aaron that asked that question.
Do you want me to answer that?
Yes, Leeza, please.
Yeah, absolutely. So in order for someone to be eligible for the FCS program, they need to, in addition to the Medicaid eligibility and age restrictions, they need to have one health needs-based criteria, which could be a mental health diagnosis, or it could be a need for outpatient substance use disorder treatment. So, so if someone has a substance use disorder treatment or SUD diagnosis, that would be their health needs-based criteria for the FCS eligibility. So it does not have to be a mental health need.
Yeah, and to jump in on that, so when you read the criteria, the eligibility criteria for the programs, we've also built into those criteria things like need assistance with activities of daily living, and typically 3 or more, or have, I think traumatic brain injury also falls on this side of the medical necessity side of things as well. And these are really designed to also allow us to serve individuals who are receiving services from the Aging and Long-Term Services Administration. So you don't just have to have a mental health treatment need. You could also have a substance use disorder and just a substance use disorder, or you could have some other physical disability that would make you eligible for long-term services that would make you eligible for these services as well.
All right. So another question is, said, when Taylor was speaking about housing earlier, what did he mean by commercial housing?
Did I say, did I speak to commercial housing? I actually, if I'd said commercial housing, I misspoke. I was not aware I said that. So no, yeah, that's what I got. I'm sorry if I said that.
Okay, these things happen. I see Lynn Christofferson asked about how do we apply for seed grants. Lynn, if you want to contact me specifically, I'll make sure to get that information to you. Holly said she missed where the seed grants are coming from. It's actually through a pot of money from the DBHR, but the Washington Behavioral Health Council is actually administering that for us. And so the money comes from a grant that came to the DBHR and then is funneled through that process. But do please contact me if you're interested in those, and I will send out the information. Holly said, will we be able to email you to get that information? Yes. Where do we find the recording of training webinars? There are actually a variety of places. One of the things that I'm going to do, there's a process that we have to go through in order to get our webinars posted on YouTube, and the Healthcare Authority has a YouTube channel. So that's one of the places to look for the webinars. I will send out a link to everybody that registered. We're a little behind on that process because we're still kind of getting familiar with how to do it, so it may be a little while. I will send out the PowerPoints immediately. And then the wiki also has the PowerPoints and things posted. So if you look at the Supported Employment wiki, you'll find a lot of different training materials from past trainings. So Pam had said, after the grant employment program is over less than 3.5 years, do we all lose our jobs? I'm sorry, the laughter, if you will, was because of this is a concern on all of our minds, mine too, because I'm in a project employment as well. What I can tell you is the intent is that we're doing such an amazing job of providing services that it will be apparent to those of our funders that they need to continue to fund these opportunities, the supportive housing and the permanent supported employment. I know that there are agencies out there, all of the agencies out there are providing amazing services to a lot of individuals. In the planning process, we had determined the optimum number of individuals to provide services to really be able to prove the data, to prove the impact of these programs. And so my best recommendation is continue doing the wonderful things that you are, continue adding to that great data so that we can prove that this is something that needs to be funded for the long run as opposed to just the short run.
I would echo that. So I'm involved in the evaluation activities on, sorry, let me start over. I'm involved in the evaluation team for the FCS programs. And then there's also an independent external evaluator who's been selected by the state of Washington to do an evaluation of these services, and which is Oregon Health Sciences. And they are going to be using the information that is submitted to P1, the claims information, to be able to identify individuals who are clients of the program and to be able to see how many services they got. And then we're going to be providing them, us at RDA are going to be providing them additional information, additional measures that they can use in a matching process to be able to see what impact supported employment services had and supportive housing services had. And this is, as Dawn was pointing out, this is really part of a major component of the long-term sustainability of these benefits. So we really are trying to have an eye to the future here and think about how can we make a case to maintain these benefits and continue providing them after the Medicaid transformation project is over. And I think that has always been the goal. I know that Melody Paisolt, who is in charge of a lot of this, that has always been in the back of her mind.
Absolutely.
And so just to echo, just to echo what Dawn was saying, I mean, I think that the biggest thing that you all can do is continue to provide the services, doing the best that you can, make sure that the claims data gets into AmeriGroup, and make sure that that data is as clean as it can be. And just really, it's extraordinarily helpful to us. Any type of cooperation.
Oh, we lost you, Taylor. All right. So until he's back, are there any other questions that people might have? Obviously, you can raise your hand. You can type in the chat box. And I'm looking once again to see what we've got. And it looks like, at least at this point in time, Pam had said, I really want to be trained well to, excuse me, it's hard to scroll down here, prove that funding. Thank you for these webinars. They're very informative to my success. Thank you, Pam. I appreciate hearing that. As always, if oh, fudge.
And so making sure that that data is clean is also extraordinarily helpful, I think, for your team, Leeza.
I apologize. I'm back after having gotten kicked out for a second, so hopefully nobody was asking something of me. Sorry about that. Gotta love technology. So Pam mentioned that the webinars are very helpful and informative. I would like everybody to know that these webinars can be tailored for whatever needs that the group as a whole has. So if you have suggestions for upcoming webinars, please send them to us. If you have questions related to this one, once again, please send to us. It looks like we're coming up on the 10 o'clock hour, and I really appreciate the participation that we've had, and truly appreciate Taylor and Leeza, your information and your ability to answer the questions so well. Thank you all so very much. I will be sending out the information at a later date. Taylor or Leeza, did you have any closing comments?
No, other than thank you all for everything you're doing. We really appreciate your hard work and what you're doing to help serve Washington residents.
I echo Taylor.
Thank you so very much. Everybody have a wonderful day. Hopefully it's sunny where you are as well, and we'll be talking to you later. Thanks. Bye-bye.
Thank you.
Thank you. Bye-bye.